Hello everyone, I am Dr. Aparna, Neonatologist from AIIMS, Cuddles, Kondapur, Hyderabad, and today we are going to discuss about the essential care of every healthy newborn baby at the time of birth. This is our delivery receiving warmer at AIIMS newborn unit. And these are the common steps that we do or we practice when a newborn baby is welcomed to this world. So for all term babies who are born vigorous with good breathing efforts, the role of the doctor is actually quite simple, yet to reinforce some essential steps or essential processes in the care of a healthy newborn. These include ensuring that the baby is warm, ensuring that the baby is free of infection, and ensuring that the baby is started early on breastfeeding. First and foremost, we try to follow the principle of do no harm, and we always ensure good hand hygiene before touching or doing any kind of intervention for a newborn baby. Once the newborn baby is received or born, one records the time of birth, and most newborn babies will benefit by being delivered over the mother's abdomen itself. This is called as early skin to skin contact, and this is found to increase the thermal stability of the baby, which means improve the ability of the baby to maintain normal temperature or to avoid hypothermia, and also to improve the success of early exclusive breastfeeding. The next important step is the clamping of the umbilical cord. We all know that the umbilical cord is the vital connection between the mother and the baby during the pregnancy. After birth, one has to now remember that by delaying the clamping and the cutting of this cord for at least 1 minute, the benefits to the baby are numerous. Delayed cord clamping has been found to have numerous benefits in term as well as preterm neonates. It improves the iron stores in the body, it replenishes the hemoglobin levels, and in preterm neonates, it is also associated with a decreased risk of developing intracranial bleeds, and chances of feeding intolerance and the need for blood transfusions is reduced. So one must always try to delay the clamping and the cutting of the umbilical cord by at least 1 minute or 60 seconds. The next very important aspect is to provide the baby warmth. This is easily provided by placing the baby on the mother's own chest. This also provides early skin to skin contact and an opportunity for the baby to start breastfeeding. And whenever the baby needs further assessment, we bring the baby over to a radiant warmer, which is an additional source of heat to the baby. The next very vital sign is to position the baby's head and neck appropriately. So every baby should be placed in mild extension of the neck rather than keeping the neck completely folded on itself or completely extended. So this ensures that the airway is open. Whilst looking into this, also ensure that the baby's secretions, if any, can naturally come out. Finally, the baby needs to be monitored or evaluated closely. So any baby who is just born is not entirely to be left to the family, but it is the job of the pediatricians to closely keep a check on the baby's activity, the baby's temperature, the baby's breathing pattern, and the baby's feeding every few minutes, at least for the first few hours. This ensures the safe transition of every normal newborn baby. Also remember that doctors would give your baby an important injection to prevent bleeding. This is vitamin K. This is a routine practice in all hospitals, irrespective of whether the baby is born full term or preterm. This injection ensures the optimal levels of clotting factors in the blood and prevents the chances of developing major bleeding manifestations. Last but not the least, just as we are 2 weeks ahead of the breastfeeding week, which is celebrated in the first week of August, it is also very important to ensure that every normal baby who is handed over to the mother is started on breastfeeding within the first 1 hour within the time of birth. This is one of the most important steps that we take to ensure that our babies remain healthy, free of infections such as respiratory infections, diarrhea, ear infections, and also to ensure that the baby has the best neurodevelopmental outcome or is able to reach his or her natural potential to have an optimal development. Together, all these steps, starting from the early skin to skin contact with the mum, delayed cot clamping, providing the baby warmth, and ensuring that the baby has an open airway, and early initiation of breastfeeding and the first dose of vitamin K ensures that the first few steps of the baby's neonatal care is completed. Also, one also needs to ensure that the baby's eyes, the baby's umbilical cord, and the baby's skin are optimally cared for. This is done by wiping clean both the eyes with a clean cotton gauze piece or a clean cotton cloth at the time of birth to ensure the removal of any potentially irritating substance, especially secretions which the baby might have come in contact with during the process of delivery itself. It is also important to avoid the artificial application of any drops or any other substances, sometimes like kajal, which may be applied over the baby's eyes. Similarly, ensure that the baby's umbilical cord is kept dry, clean, and avoid the routine application of powder or antiseptic solution over the umbilical cord. The umbilical cord will naturally fall off by 7 to 10 days of birth, and during this time it may be better or safe to avoid bath to the baby. Likewise, avoid any regular applications of soap or creams or powders over the baby's skin, and ensure that the baby's skin is kept free of any kind of infection. All these steps can ensure that every baby has the most optimal chance of being free of morbidity, infections, and hypothermia. Thank you.